Well, tonight we've got lots of questions for our doctors all about reopening our world. And here to lend their guidance and expertise, ER physician Dr. Taslim Nimji and infectious diseases specialist Dr. Allison McGeer. Hello to both of you. Lots of questions to get through tonight, so let's get started. Number one, Dr. McGeer, maybe this one will be for you. How long do you think until non-essential workers can go back to work?
So the first answer is a while, and the second answer is already some of them will be going back to work this week. There's going to be a gradual process where we try to allow as many people as we can to go back to work while not triggering the outbreak again. So for some people, it's going to be a matter of days. For some people, it's going to be at least weeks.
Okay. Dr. Nimji, here's the next question for you that I'd like you to field for us. I don't feel safe going back to work and being around other people. Am I overreacting?
I think the first thing is, no, you're normal, right? Like there's a lot of anxieties around this, and this is the first time we're going through something like this. I think what's important is to understand that there's a lot of measures in place before we're allowing people to go back to work. And as long as your employers are following those measures and you're following the guidance that's being given to you and keeping distances, and they're going to be staggered, shift times and things like that, those are all there to help keep you safe.
Okay. Dr. McGeer, if you've recovered from COVID-19, can you stop physical distancing?
Wouldn't that be nice? The answer is no, not at the moment. We're really hoping that people who have recovered will be protected in both the short and long term from sexual infections, but we don't know that yet. And as long as we don't know that, it's just not safe to say you can ignore social distancing.
Okay, good to keep in mind. Dr. Nimji, still on reopening, what could stores do to make sure customers are safe?
Yeah, so there's different things that they can do. One is certainly ramping up their environmental services, and that's like cleaning things down more frequently than they would have had to do before. They can also do things like, having special hours where those that might be more vulnerable could use those hours and keep the numbers of people going through their stores at those times fewer to allow, again, for not bumping into people and not being able to preserve those distances. So that's another big piece of it. And then just staggering hours. So even for the rest of us that might fit normal hours, you can limit the amount of flow going through a store. And so you're going to see a lot of that, including limiting the amount of services that you're providing when you're starting open. It's all like sort of phased approach.
But I'm noticing you didn't mention PPE, personal protective equipment.
Yeah, so there is that as well, and it'll be interesting to watch sort of in terms of what we all decide to do from a universal masking type of perspective. You're going to see a lot of use, I think, in the general public of cloth masks, which we've already seen. Whether or not that's going to come across as a directive to say you must do this, I'm not certain that that's going to be the way people go. But certainly for those that are providing services where they're going to be in closer contact, I think that's where you're going to see a lot more push to be using the appropriate types of PPE.
Time for one more quick question, Dr. McGeer, one that many provinces are grappling with. What could a safe return to school look like for students?
Well, a lot like Dr. Nimji's already been talking about. So measures that allow you to maintain social distance, additional hand washing and alcohol rub for hand hygiene, care not to allow crowding. It's of course a little harder to tell 6-year-olds to stay apart from each other than just to tell adults. But all the same measures, trying to maintain distancing, trying to keep things clean, making sure your hand hygiene is good.
All right, doctors, thanks so much for your time.